Okay. So go ahead and lead it off there, Amada.
All righty. So we have, I'm just going to read off the case. A 24-year-old Gravida 1 Para 0 woman named Maria presents to the hospital. She is 34 weeks gestation and having intermittent pelvic pain, which she believes are contractions. Maria is accompanied by her 39-year-old boyfriend. Social history: Maria lives in a mobile park with her partner and his 7-year-old daughter. She states that she strongly considered giving up the baby for adoption because of financial and other reasons. She reports she has not had any prenatal care, but has been taking care of herself. She says she has quit smoking and drinking and is eating daily. She is not currently working as she recently lost her job, and states sometimes learning new things is really hard and things have been very stressful. So she relies on her partner for support. She states she is not close to her family as there is a history of significant physical and emotional abuse with her mom and stepdad. So I guess kind of going through those, picking out things that stood out. First, the patient hasn't had any prenatal care. So the assessment, we have to be thorough to ensure that the baby's okay and she's okay. In terms of weight and nutrition, since she says she is eating daily, we want to assess what that means. Was she not eating regularly before? So kind of barriers to nutrition. She has a history of smoking and drinking, so that could potentially be adding to her risks or in the baby's risk of complications. When did she stop smoking and drinking? From when she knew she was pregnant to then. And then she also states financial reasons for possible adoption. So the financial reason could be a reason as to why she's not receiving prenatal care. So we want to assess her, does she have insurance? Does she have proper, just I guess the financial stability to take care of herself and the baby, and the resources we can connect her with. So the social worker.
Yeah, that's one of the biggest things that I kind of found for her was linking her up with a social worker to really kind of get some of those resources that were kind of needed for her.
Yeah, I think that was a big thing for her. I think like the bottom ones, like what kind of interventions for psychosocial.
Yeah.
I think the social worker is a big thing for her and the family.
Yeah.
For financial, and also we'll see
Would they
later
help
with the depression.
Would they help with the other reasons too?
They could.
Yeah, we can
kind of dig into what the other reasons why she might have something.
Right. Okay.
Yeah, and then so another part was the history of physical and emotional abuse. So I kind of want to make sure she's not still going through abuse at home.
Yeah. I made a point on the family-centered intervention deal that to really kind of eliminate, so she's not close with her immediate family, that her family is now just kind of her baby and her, and that kind of needs to be the family-centered intervention. So getting her involved in like some kind of like familial violence or domestic violence kind of treatment and stuff like
a
that.
therapy group.
Yes, have a support system at all, it seems like.
Right. And then it's like, what is her relationship with the 7-year-old daughter? Is the 7-year-old daughter getting, possibly abused as well?
Right. Yeah.
Because we would want them to check out that as well, right?
Yeah, absolutely.
Okay.
There could be a lot more going on behind the scenes that we don't really know.
Right.
Kind of getting in and asking her some of those questions and getting that social worker involved for sure.
Yeah, like one of the risk factors for like abuse is that they financially rely on their partner, and that was kind of a big thing that kind of mentioned it in the case. Yeah, she lost her job and she relies on him, so that can be kind of a hint.
I think that kind of covers the a lot of the psychosocial stuff. So the other side of things would be her physical presentation would be
Mhm.
a lot. There's some pretty important stuff there. Like with her blood pressure, it's definitely very at risk for like preeclampsia. She's definitely in that zone of we need to start considering treatment, since she also stopped, or she had her high blood pressure medication for a few years. And but when she found out she was pregnant, she stopped taking that. So we need to start getting some like pharmacological interventions on board to really get that blood pressure down.
That
Yeah.
and then her pelvic pain, at 34 weeks gestation.
Mhm.
Because the first thing that came to me is like, okay, is she getting her hydration every day? That's the first thing that I thought about.
Yeah.
You didn't mention that in there. And then the other thing with the UTIs, because of the hormones and how they interact with the body, is kind of common in pregnancy. I was reading about that.
Seems like her physical presentation also puts her at risk for preterm labor.
Yeah.
Right.
Very pale and notable bruising on her arms, back, and legs. The notable bruising on her arms, back, and legs, is that relate to the violence type of thing, or what's going on there? Like that's those are a lot of questions we do need to ask her as well. Maybe does she have any periumbilical bruising and stuff like that too? So that's kind of stuff we need to
Right, like signs of trauma
Right.
to
that
the
could
to the
indicate, yeah.
uterus. So what else?
We need to address her depression and the fact that she stopped taking her medications for her depression. That puts her at many risks. I think since she's obviously kind of at risk for preterm labor, this can be a good way to kind of assess for the violence, because she's going to be in the hospital probably long term, at least a couple days. So just making sure that an assessment can be done without him around to kind of dive into the bruising and basically the lack of care. She probably didn't come in because there is a history of violence. And that's probably why she didn't get the prenatal care and all of that done.
Yeah.
But the immediate, would be the blood pressure and risk for preterm labor.
Mhm. Yeah, get that blood pressure back down into like the 140s. Let's see, maybe even considering to implement if we're in the emergency room situation or whatever, implementing some seizure precautions just because her blood pressure is really high. So stuff like that.
And then she'll likely get treated for the infection depending on the culture.
Yep.
Yeah. Overall, I think her blood pressure is urgent. I think that's probably the priority, along with the low amniotic fluid to make sure that the baby is okay. So we want to assess the baby. And then once she's stable, really dive into the psychosocial, the signs of abuse and lack of care. And then kind of with the social worker proceed to like assess like, where do we go from here? If she really does want to do the adoption, kind of providing information for that.
Well, cool. I think that that kind of wraps that up. Is there anything else anybody wants to add to this case study?
No, I don't have anything additional to add.
Me neither.
No.
We'll go ahead and stop the share on this one.